I know this is a time when we're traditionally thinking about spring break, Easter gatherings. These are not normal times, and we cannot act as if they are.
Breaking at 5 o'clock, Hoosiers will have to stay home for 2 more weeks, with the anticipated coronavirus peak still weeks away. Governor Eric Holcomb is extending the state's stay-at-home order until midnight on April 21st.
And he also announced Indiana has been granted a federal disaster declaration. Meanwhile, the U.S. Coronavirus Task Force set to once again hold their daily briefing any moment now. We could learn more about any potential new guidelines regarding face masks. Until then, we have team coverage tonight, and we start with News 8's Julia Dang, who has the latest on that extension of the state's stay-at-home order. Julia.
Yeah, that 2-week extension of the stay-at-home order, not entirely unexpected. In fact, some even questioning why Governor Holcomb did not call for a longer extension. Now, the governor made it clear this is a fluid situation. They are reevaluating daily. For now, Indiana's public emergency stands to last through May 3rd. That date could ultimately be pushed back as new testing, infection, and unfortunately, death figures continue coming in. Despite the ramped up federal support and state response, the Indiana State Health Commissioner says each of us need to continue doing our part by, of course, staying home. She outlined why this may be even more critical for Hoosiers than other Americans.
We continue to hear that many of our patients who die of COVID-19 also have multiple underlying medical conditions such as heart disease, lung disease, or diabetes. Unfortunately, Indiana has a higher proportion of individuals who have these conditions as compared to other states, which makes obviously those individuals more likely to have severe illness or death from COVID-19. But as you can see, we're also seeing deaths occur even in some younger individuals, and that's why it is so important that we take these special precautions and stay home.
And the stay-at-home order does not cover government employees and other essential workers. For now, the state has not announced any plans to narrow its definition of essential business. The governor also is not mandating any kind of one-size-fits-all response among all Indiana counties. To be clear, he says he is okay with localities issuing their own orders on top of the stay-at-home order. One example is Decatur County now halting all restaurant carryout and delivery, which is still allowed in other parts of Indiana. Live in Indy, Julia Dang, Wish TV and WishTV.com, and be sure to follow us on Facebook.
Julia, thank you very much. Social distancing and stay-at-home orders are having an impact on Hoosiers' mental health. State health leaders today revealing some alarming numbers. Indiana's 211 service, which helps Hoosiers and find local resources they need, has seen a huge jump in calls. From around 1,000 calls a day to 25,000 calls a day, many related to mental health and suicidal thoughts. Addiction hotlines that average 20 calls a week are now averaging that per day. And 2 agencies in southwest Indiana report a 50% increase in crisis calls. Dr. Jennifer Sullivan, the FSSA secretary, wants Hoosiers to know help is out there.
Our message to Hoosiers going through this is twofold. 1, it's normal to feel this way. And 2, help and help that works is available. If you find yourself experiencing these symptoms, please seek help. You can call 211. You can contact your insurance company to find access to teletherapy. And you can talk to your doctor about whether medication might be right for you during this time.
And during today's news conference with the governor, a mental health expert offered Hoosiers an introductory telehealth appointment. He offered some tips on what you and your family can do at home tonight or this weekend to deal with the stress and anxiety during these unprecedented times. You can watch Dr. Ahmed's full session right now on WishTV.com. State health officials confirming 24 more Hoosiers have died today. That boosts the state's death toll past 100. An additional 408 positive cases also brings the state's total to more than 3,400 cases. And first responders part of that rise in cases. Wish TV now being told an entire IMPD unit may be infected. News 8's Richard Essex joins us now with the latest. 17 IMPD officers have tested positive. Richard.
That's what we understand, but there is some good news. There have been 2 firefighters and 2 EMS workers that had tested positive and have returned to work. But Wish TV was told this morning that one detective had tested positive and may have infected all the others inside of his unit. Now, when I was told this morning, I was told that the entire unit was sent home out of an abundance of caution. IMPD will not release information about the officers. All first responders in Indianapolis are instructed to practice practical social distancing when appropriate and wear personal protective equipment when necessary if it is available. Rick Snyder, the president of the local police union, says the department is just starting to feel the strain of this virus.
Well, we're aware of units that have been significantly impacted by either a positive test or a concern of a positive test. It's one of the things that we've said publicly. You have to remember that for every officer that we have a documented positive test for, you can usually estimate at least 5 to 10 more officers that we then have to immediately put into quarantine and then get them tested.
IMPD has stated that there are dozens of officers in quarantine, but they have not released an exact number. There is a growing concern over the availability of personal protection equipment amongst all first responders. Now, police do have access to a large, almost a gas mask type looking device, but they are supposed to use that as a last resort and not first resort. In downtown Indianapolis, Richard Essex, Wish TV, wishtv.com, and follow us on Facebook.
All right, Richard, thanks so much. Well, some people are trying to use this crisis to their advantage by getting away with your money. My teammate Stephanie Zeppelin spoke with federal authorities about what you need to watch out for.
Brooke, anytime there's a crisis, financial or a natural disaster, the FBI, IRS, and U.S. Attorney's Office say scammers come out of the woodwork. One of the big concerns in this area is the stimulus payments, $1,200 or more. The IRS is worried people will try to get their hands on your check. They say the IRS will never call, email, or message you on social media to get your information for the payment. You're going to get the payment directly into the bank account you last gave them or on a paper check mailed to the address they have on file. And there's nothing you can do to speed that up. Anyone saying you can pay a fee to get your check sooner is trying to scam you. Another thing to watch out for, fake charities.
It's very common that we'll see people saying they're a charitable organization and asking for money, donations. In times of crisis, people are very generous. They want to help. It's one of the great things about Indiana, about this state, about this country. People hear about crisis and they're like, where can I send my money?
You background check any charity asking for money. Do not let them pressure you into donations on the spot. Other scams to watch out for, fake tests and cures, phishing emails posing as health authorities, robocallers selling supplies, and investment fraud. Another consumer issue to be aware of in times like these is price gouging. We're talking to the Indiana Attorney General's office on News 8 at 6 about what they're seeing in our state. Stephanie Zeppelin, Wish TV, wishtv.com, and follow us on Facebook.
All right, Stephanie, thanks so much. Remember to head to wishtv.com for all the latest coronavirus coverage. Just find the banner on our homepage.